Hi, I'm Shanthi Kappagoda, Clinical Associate Professor in the Division of Infectious Diseases, and I'm one of 3 physicians, along with Dr. Amy Chang and Dr. Jenny Aronson, who work at the Stanford Orthopedic Infections Clinic in Redwood City. In this clinic, we see people with bone and joint infections and wound infections. These are things that are managed collaboratively with surgery and infectious diseases. Our clinic has more than 40 subspecialty orthopedic surgeons, including bone and joint replacement specialists, podiatry, trauma, foot and ankle specialists, hand and shoulder surgery, and bone tumors. There's also a busy wound care center staffed by 11 different physicians, mostly in plastic surgery and vascular surgery. We also have a large group of musculoskeletal radiologists in the building whom we can review MRIs and X-rays with. The most common thing we see here are prosthetic, knee, and hip infections. These are complex infections to manage and involve both antibiotics and surgery. We see patients together in the clinic with ID and orthopedic surgery. We discuss the plan collaboratively with the patients. A lot of our patients recently had surgery and are using a wheelchair and crutches, and they really appreciate being able to come to one visit and see both their surgeon and their infectious disease doctor. A lot of our patients come from a long distance to get their care at Stanford as well. We also participate in a monthly multidisciplinary conference for limb preservation called STEP, Stanford Extremity Preservation Program. This is similar to a tumor board, except instead of reviewing patients with cancer, we review patients who are at risk of needing an amputation. It's a multidisciplinary meeting with orthopedic surgery, podiatry, palliative care, infectious diseases, musculoskeletal radiology, and social work. The idea is to bring all the specialists together, review the patient's case, and make recommendations to prevent them needing an amputation. As a fellow, you'll have a chance to join us in this clinic and get very comfortable with managing bone and joint infections. And for people interested in orthopedic and ID research, there are a lot of opportunities to collaborate with our orthopedic surgery colleagues on clinical research projects. Thanks so much for your interest in our fellowship program, and hope it also sparks an interest in orthopedic infections. Thank you.
The preceding program is copyrighted by the Board of Trustees of the Leland Stanford Junior University. Please visit us at med.stanford.edu.